Hi, good morning. I don't know if you can hear me clearly. So, streaming all the way from Nigeria. Good morning. If you are joining my live, you're welcome. Do wait to hit there. Jason, I can see you. Okay, Kenya, you're welcome. I'm streaming from Nigeria, and here now is 8. Sorry, now is 8:13. 13 minutes after 8. So I came to connect with my audience to know what they are doing, how their day is going. Nice home. Thank you so much. Thank you so much. So, how is Kenya? So today, we're going to talk about even if you're a man listening to me in this life, you are welcome. At least you have some loved ones, like you have loved ones, your sisters, your siblings, maybe your girlfriend or even your wife. So today we are going to be talk. I have a YouTube channel. Really, what do you talk about in your YouTube channel? I'll give you a follow once I end my life, Jason. Thank you so much. What's your niche? I'll like and subscribe. Yeah, thank you so much. So today we are going to talk about a health condition known as an endometriosis. So if you're a man here watching me, maybe you have sisters, or maybe you have your girlfriend, or maybe your wife, and I want you to listen to this life so that you learn things that you can explain to them, because we have normalized painful period as something that is normal, but actually is not. You understand? Painful period is not normal. Growing up, I thought that it was like that kind of period that will make you to roll on the floor. You can't sit, you can't eat, you can't, you can't do anything. So it's not normal. It's not normal at all. If you have someone that experiences such kind of thing, I want you to go for a checkup. Even if you go to hospital and they tell you that having painful period is normal, I just go to another hospital. I can remember there was a certain time, I think a lady came to us, a friend of mine. So I discovered that anytime she wants to see her period, that her own drugs doesn't work for her. She takes injection every month, painkillers, that diclofenac injection every month just to ease her pain. And once it starts, she won't rest. So all those kind of signals, when you some doctors will tell you, some person will tell you, some healthcare professional will tell you that it is normal. Having such kind of period, it is normal, but it is not normal. Cruciating periods are not normal. It can be a pointer that something is wrong somewhere, and that could be endometriosis. Thank you for joining my live. Live, Vivian. Is this Vivian live? Thanks you. Thanks for joining my live. Hi. Where are you streaming from? So I want you to understand that endometriosis is a condition where the endometrial cells of the uterus, which also known as the endometrium, grows outside the womb. Now, these endometrial tissues can grow in your bladder, can grow in your intestine, can grow in your ovaries, can grow. I love your hair. Another, my hair is just weave. You can see it. I just braid it. I spent, is it 500 naira? What's better, cornflakes or rice krispies? I think rice krispies will be better. I don't know. I'm not a fan of cornflakes. Hello, I can see you. Libet. I'm not a fan of cornflakes. I don't like it. I don't like anything processed food. I prefer eating whole food. If I want to eat any food, let it be whole. If it is rice, eat rice whole. Like nothing like processed this thing. Just eat it the way it's supposed to be. Jesus, Kings of Kings, Lord of Lords, heroes, the heroes of faith. Thank you so much for joining my life. I'm eating jollof rice. Come and share. I would like to eat. Hope you remain for me, or you are just eating it alone. Eh? So which animal are you pairing the giraffe lice with? Is it chicken? Is it beef? Which animal? Because my other sister always call meat animal. When you give her any food without meat, she will say, where is animal in this food? Where is animal in this food? So if there's no meat in that food, she will say, where is animal? I'll save it for you. Thank you so much. Please save my own giraffe rice. Hello, this one is saying hello, how are you? I'm fine. Where are you streaming from? Nigeria? So, as I was saying about endometriosis is the condition where the tissues of the uterus, you know that the uterus normally shed during menstruation. That's the blood you normally see as a lady, you understand? So, in condition like endometriosis, that's lining of the tissue, that's that lining of the womb that looks exactly like the womb, can grow outside the womb, can grow in your bladder, can grow in your intestine, can grow in your ovaries, can grow in your fallopian tubes. Endometriosis can cause tuber blockage, you understand? It can cause tuber blockage, it can cause damage of the ovaries. So endometriosis is not something that they take lightly, although they say that it's a period, it's normal, is not. That painful period can be a pointer of endometriosis. Now, one thing about this endometriosis that people don't know about is that normally every month the uterus shades and the blood is supposed to go out, right? But in endometriosis, if this tissue grows outside the womb, the blood is stuck there. It thickens, it shade like a normal blood, you understand, like a normal period, but just that it doesn't rush out. So that causes that inflammation they normally experience, and that painful, that pains, you understand, that pains her. What do you mean by her? Subscribe to her. Okay, to your channel. Okay, say hello from USA. Are you talking about vaginas? No, I'm not talking about not really vagina. I'm talking about the condition known as endometriosis. It's a medical condition that affects women. So if you have loved ones like your girlfriend, your wife, your sisters, you pay attention to it, because anytime they complain to you that they have a painful period, tell them to please cease, go and check it out. This might be pointing to something. This might be pointing to something. Say subscribe to her. Don't worry, I'll subscribe to your channel once I end my life. I'll subscribe to your channel once I end my life. So it's not actually normal. So you might be asking, does endometriosis actually affect fertility? The answer is yes. Endometriosis can affect fertility, but that does not mean that if you have endometriosis that you cannot get pregnant. So just don't get it twisted. If you have endometriosis, that does not automatically mean that you cannot get pregnant as a lady or as a human. You can get pregnant, but just that some persons may need medical assistance, like medically, to assist the pregnancy, or maybe they can conceive naturally. Endometriosis does not stop you from getting pregnant, but just that it can affect fertility. The reason why it can affect fertility, imagine this endometrial tissue growing in your ovaries, and you know that your ovaries is where egg is produced. So if it grows there, it can damage the egg, and once the egg is damaged, how will fertilization occur? It won't, right? So endometriosis can actually affect fertility, but endometriosis is not all about fertility. That is one thing that people don't understand. Yes, it can affect fertility. It's not like a baby machine problem, it's like a whole body problem, because when you have endometriosis as a lady, it can affect it. You experience severe pelvic pain. I have to go. Okay, I have to go and play. Bye. Have a good day. Okay, you want to go and play? What? Why are you going to? What are you going to play? Stay a little bit longer now. Don't worry. I'll give you a subscribe. I'll subscribe to your channel. Okay, football. You play football this early morning. Isn't it too early to play football? Now is 8:22. I think it's very early to start playing football this morning, although it's a form of exercise also. It's a nice one. For those of you that exercise, me, I'm very lazy when it comes to exercise. I don't know. There was a period I went to the gym. I can remember that was either 2024. So when I went to the gym, they were looking at me. Then I was a little bit slimmer than now. I'm always slim. I'm not a fat girl. You understand? No matter what I eat, I remain this stature. So when I went to the gym, they were looking at me. One auntie that was fat like that. Sorry to use that word. So she was like, What are you exercising for? Like you want to exercise, you will break. Oh, you understand? You will break. So I was like, why would this lady be saying? Is it that exercise is only meant for women that are slim? You understand? Is it only for women that are slim? No, exercise is not only for women that are slim. It makes you strong, helps you to build muscles, also stamina. But just that is stressful because after that day I did that exercise, my legs were paining me. My legs were so painful. It took me time to recover. So, what do you understand by endometriosis? See, Kate, I say hello from USA. Is it hello? So, endometriosis is the condition that affects women. It's a whole body problem, not just a baby making problem. Because if you have endometriosis as a woman, it can affect both your mental health. Imagine having excruciating pain every month. If, even sometimes it's not even, you don't even have to wait every month before you start experiencing such kind of pain. So it's a kind of whole body problem because you won't get yourself. And another question, another thing people normally misunderstand about endometriosis, some persons believe that pregnancy can cure endometriosis. Well, pregnancy does not actually cure endometriosis because there's no cure for endometriosis. Just that when you are pregnant, the body produces progesterone, and that progesterone stops you, like that have high level of progesterone stops you from menstruating. You understand? It sustains the pregnancy in the uterus so that the uterine lining will not shed. So during that period of pregnancy, that shading of the uterus, you will not experience it. But once you give birth, your hormone still returns back to normal. Your period start again. And when your period start again, the symptoms still continues. So pregnancy is not like a permanent cure for endometriosis, but pregnancy can be a, we like a temporary pause for people that has endometriosis, but not like a permanent cure for it. You understand? Now, the reason why it's like that, because when you are pregnant, those hormone that makes you to menstruate, progesterone level is high. Remember, during menstruation, progesterone level is supposed to be low for your uterine lining to shade. I explained this thing on my video. For menstruation to occur, your progesterone level is supposed to come down, and there's a reason for it. If you want, I can explain all these things in my life. Now, there's a reason for it. If progesterone level is high, your uterine lining will not shade because that progesterone level helps, that high progesterone helps to maintain the uterine lining. That is why during pregnancy, people that have low progesterone, they tend to have miscarriage. The reason why it's like that because your progesterone helps to maintain that pregnancy, it helps to prevent that uterine lining from shedding. So during pregnancy, your that progesterone level is high because that corpus luteum that releases that follicle that releases that egg turns to corpus luteum and starts producing progesterone. That is why in some cases doctor will tell you that pregnancy will help in endometriosis symptoms, but just that it doesn't cure it, but just that it can give, like, it can ease the symptoms. You understand that painful symptoms you normally experience can, if, because during pregnancy you don't menstruate. Of course, you don't see your period during pregnancy, although some persons they do, but medically you're not meant to see your period during pregnancy. So that high level of progesterone helps also. That is why progesterone therapy is also one of the treatment for endometriosis, for people that has endometriosis. Now, that is it for that. For you to understand the way the body, the female body works, we have four cycle. Fourth cycle, we have the menstrual cycle. Menstrual cycle lasts from day one of your cycle either to day 4 or day 5, depending on your length of your cycle. Now, the second cycle is your follicular phase. Your follicular phase starts from your day one of your cycle to a day before your ovulation. Your ovulation is ovulation phase is another phase of your cycle. Remember, we have four phases: your menstrual phase, your follicular phase, your ovulation phase, and your luteal phase. For your menstruation to occur, progesterone and progesterone level needs to be low. Follicular phase, progesterone level needs to be low. Estrogen will start coming up because that estrogen helps to for maturation of eggs, of your follicular eggs. You understand? So that is why if you really understand this how this our body works, you understand why women attend they normally tell women that normally take all this postinion too, that they should take it before ovulation. The reason why it's like that is because, let me explain. The reason why it's like that, they tell women to take postinion 2 before ovulation. Postinion 2 is a synthetic form of the hormone progesterone. Another name for postinion 2 is levonorgestrel, which is a synthetic form of the hormone progesterone. Now, when you take a synthetic form of the hormone progesterone before ovulation, you are indirectly increasing your level of progesterone, like you are increasing the level of the hormone progesterone before ovulation, because progesterone level is not supposed to be high before ovulation. Progesterone level is supposed to be low before ovulation. For ovulation to occur, progesterone level is supposed to be low. There's a reason for that, which I will also explain in this live video. Now, if progesterone level is high before ovulation, you are indirectly telling your brain that, oh, ovulation has already occurred, there's no need for ovulation. That is why when you take postinion 2 before ovulation, you are indirectly increasing that hormone progesterone. This is how the mechanism of these drugs works. It's not like how will I put it? It's not like a which how will I put it? So it's more of the hormone. You understand? It's a hormonal drugs that increases your progesterone level because it's a synthetic form of the hormone progesterone, and it's taken before ovulation. So when you take postinion 2 before ovulation, you are increasing the level of progesterone. So you're indirectly telling your brain that ovulation has already occurred. There's no need for ovulation. You understand? So when that happens, either the brain delays that ovulation from happening or it stops it from happening. So that is how these drugs works. So in your menstrual phase, progesterone level is low. Your follicular phase, your menstrual phase is from your day one of your cycle, the day you start seeing your period. That's the day one of your cycle. It can last 4 days. Progesterone level is low. Your follicular phase, progesterone level is low. Your ovulation phase, progesterone level is also low. So 7 days after ovulation, when the egg is already released, that follicle that releases that egg turns to a corpus luteum and start producing progesterone. The reason why it's like that, because the body is designed to hold pregnancy. Now imagine after you ovulate, then maybe fertilization occur. That progesterone, that follicle that releases that egg turns to corpus luteum, start producing that progesterone. That progesterone is what will support that pregnancy. If you have any question, you can drop in the comment section. My Jesus be with you. Thank you so much. Thank you for joining my life. Just your local Jesus Christian, just your local Christian girl. Thanks. Thank you. Thank you. So as I was explaining, so after your ovulation, 7 days. That's why, for you to know if one of the criteria to know if you're ovulating, also your progesterone level. That's the secret. Another way to know if you're ovulating as a lady is your progesterone level, and it's normally to know that either you go 7 days after your ovulation to check how high your progesterone level is. Because if your progesterone level is very high, then you know that ovulation has already occurred, because it's a way of your body telling you that so physiological process has already happened in your body, because your progesterone level is supposed to be high after ovulation, just to support implantation or pregnancy, just in case if pregnancy occur. But if pregnancy does not occur after that, that corpus luteum breaks down, progesterone level comes down. Then when progesterone level comes down, then you enter the luteal phase. From there, your menstrual cycle. You understand? So this is how everything works. So endometriosis, like as I was saying before, endometriosis is a condition that affects women. You understand? And it's kind of misdiagnosed or either diagnosed late. And one of the reasons why it's like that is because can't easily spot this endometriosis. No, can't easily spot it with normal scan tests. You can't just walk into and they just scan you and see that you have endometriosis. That is why sometimes it's either misdiagnosed or is diagnosed late. So that is it. Is laparoscopy they use to screen for this endometriosis. So if you have any question, you're a lady or a man, you just want to ask question, you can just drop it in the comment. Any question at all, even if it's not related to what I'm saying, even if it's not related to any health topic, just drop your question. I will answer you. Just your local Christian girl. Thanks for joining my life. So that is how it works. So when you talk about your menstrual cycle as a lady, your menstrual cycle does not only end when you see your period. That's not true, because some persons think that way, that menstrual cycle is only when you see your period. No, menstrual cycle comprises your full cycle. If you have 28 cycle, that's your full cycle. If you have 25 cycle, like your cycle is 25 days, that's your full cycle. Your cycle is 28 days, that's your full cycle. And it comprises 4 phases: your menstrual phase, your follicular phase, your ovulation phase, and your luteal phase. Remember your ovulation time, the day of ovulation does not last for days, it lasts for hours, 12 to 24 hours. So if fertilization does not occur that period, if maybe you do not meet any your spouse that period, fertilization will not occur. So for fertilization to occur, you need to meet your spouse within that period to get pregnant, if you are planning to get pregnant. So that is it for. So the menstrual cycle does not only end when you see your period, like the days you see your period. Your menstrual cycle comprises your entire cycle. If you are 28 cycle, then it comprises your 28 cycle. If you have that's 28 days, if your cycle is 28 days, then it comprises 28 days. If your cycle is 25 days, then it comprises the whole of 25 days. Now the whole cycle, we have 4 phases in your menstrual cycle: your menstrual cycle, your follicular phase, your ovulation phase, and your luteal phase. And each of these phases, different hormones are working in accordance to your body as a lady. Now for your menstrual phase, your menstrual phase is your day one of your cycle, the day you see your period as a lady. That's your menstrual phase. It can last for 3 days, 4 days, 5 days, some ladies 7 days. Why for your menstruation to occur, your progesterone level is supposed to be low, because progesterone tends to prevent the shedding of the uterine lining. You understand? It tends to prevent the shedding of the uterine lining. That is why people that have low progesterone during pregnancy is kind of at risk of having miscarriage, because that low progesterone there is a risk, because progesterone helps to maintain the uterus from shedding. It helps to maintain the uterus for shading. So during your menstrual phase, your progesterone level is supposed to be low for menstruation to occur, for the uterus to shade out blood, to shade out its tissues. You understand? So your follicular phase starts from your day one or so of your cycle to a day before your ovulation. That is your follicular phase. Now your follicular phase comprises of both your LH, that's your luteinizing hormone, your stimulating hormone. Estrogen level will rise during your follicular phase just to stimulate your LH, and LH is supposed to rise either 24 hours to 35 hours before ovulation occur. That is why for those tracking your ovulation, if a lady, you are tracking your ovulation and you are using ovulation test kits, you track your ovulation. If you know your cycle very well, you track your ovulation either 2 days or a day before your actual ovulation day, because your LH surges up, rises up 24 hours to 35 hours before your ovulation. So that is for follicular phase. Now after follicular phase, when the egg is already matured, you understand, then comes the ovulation phase. The ovulation phase is the release of egg from the ovaries. So this ovulation phase lasts 12 to 24 hours. So for fertilization to occur, you must meet your spouse during this period. Ovulation, what they call it, fertilization does not take place every days of the month. No, it doesn't take place. Or for you to get pregnant, you have to time yourself, because any sex you're having after your ovulation, when the egg is not has dies off, or maybe when the egg is not released, you're just having normal cells, not for what they call it, fertilization. So you must meet your spouse 12 hours to 24 hours after, during your ovulation. So after your ovulation, progesterone level is still low before ovulation. Then after ovulation, 7 days after ovulation, progesterone level rises. The reason why it is like this is because that follicles that releases that egg during ovulation turns to the corpus luteum and start producing progesterone. That is why another way to check if you're ovulating as a lady is also your progesterone level. If you want to know if you're ovulating as a lady, it's also your progesterone level, to check if it is high. And it's supposed to be high after ovulation, because after ovulation that progesterone is supposed to support a pregnancy. You understand? So after ovulation, you have the luteal phase. The luteal phase, then you enter your menstrual phase also. So that is how it is. If you have any question, you can drop it in the comment section. I'll tend to answer you any question at all, even if it's not related to what I'm explaining, even if it's not related to any health topics, even if it's a personal question you want to know me as my audience, I promise to answer. Drop it in the comment section. For those joining my live, you're welcome. You can drop any question you want me to answer in the comment section. Let me just get this done. Sorry. You can drop your question in the comments. ask me anything you want to know, even if it's not health related. Just ask me any question. Drop your question in the comment section. Hello, if you're joining my live, do wait to subscribe and hit the notification. So just ask me any question. I was talking about endometriosis, how it affects women, and how we should not normalize painful period because not all periods are normal. Some can be a pointer that something is wrong that needs to be fixed. Thanks for the likes. So drop any question you want to ask me, even if it's not related to health. Just drop it in the comment section. So I was explaining that women have four phases in the menstrual cycle, not just um, the menstrual phase. That's when you see your period as a lady. There are four phases in the menstrual cycle. So drop your question. Drop your question. Any part you don't understand, you can drop it in the comments. So the four phases of the menstrual cycle, your menstrual phase, that is the time you see your period, your follicular phase, your ovulation phase, and your luteal phase. And each of these phases, they have hormones that works. Now, for your menstruation to occur, your progesterone level needs to be low for menstruation to occur because progesterone tends to prevent the uterine lining from shedding. You understand? It tends to prevent shedding of the uterus. That is why women that are pregnant, if you have low progesterone, you have high chances of having miscarriage. In fact, low progesterone is one of the leading, not like it's the only cause of miscarriage. It's one of the leading cause of miscarriage in women. The reason why it's like that because progesterone tends to prevent you from cramping, helps to prevent uterus from shedding. So during your menstrual phase, that's your period, the days you see your period, this progesterone level needs to be low. Just like I explained to you, the reason why it's supposed to be like that. Then for your follicular phase starts from your day one of your cycle. That's the first day you see your period to a day before your ovulation. Because during this phase, your LH needs to rise. That's your luteinizing hormone. This follicle stimulating hormone helps to mature the egg. You understand? And AH rises 24 hours to 35 hours before ovulation. That is why anytime you are using this ovulation test kit to track your ovulation, you need to test for AH either 2 days before your ovulation or a day before your ovulation for you to get a accurate result. But because if you don't test that period, you might get a wrong result. You might be thinking that you don't ovulate, but the truth is that it might be ovulating, but just that you don't really know when to track it. You understand? So the best way to know when to track your ovulation is using ultrasound. Honestly, that's the best way to track if you're ovulating, to know if you're ovulating or not. Although they have three major ways to know if you're ovulating. One is your progesterone level. Yes, if you don't know, your progesterone level is also a signal if you're ovulating or not. If you have low progesterone after your ovulation, it might signal that you might not be ovulating because your progesterone level is supposed to be high after ovulation. The reason why it's like that because that follicle that releases that egg supposed to turn to corpus luteum and start producing progesterone to support intending pregnancy, just in case if pregnancy happens. That is the reason why progesterone level is supposed to be high after ovulation. So if you want to check if you're ovulating, checking your progesterone level 7 days after ovulation is also another signal of knowing if you're ovulating or not. And another way to know if you're ovulating or not is by using ovulation test kit, that's to check for LH, that's luteinizing hormone. And if you must check for LH, you must know your cycle. You don't just take this kit and start testing any day in your cycle. It doesn't work that way. You won't get the results you want to get, and that will give you a false result. You might even start thinking that you don't ovulate. That will give you a false answer and a false result. So you must track your cycle very well. Now you should know when is your fertile window period. You should know when is your fertile window period. For people that have 28 cycle, you should know that from day 14 is your, like, your ovulation day. You understand? But it's not easy, it's not a must that you must ovulate that day 14. But at least you should start tracking from day 10 of your cycle. You should start tracking from day 10 of your cycle. So for you to get a more clearer result, you can start texting, or maybe 2 days before your ovulation or 3 days before your ovulation, if you have enough of this kit at home. That's an ovulation test kit. So because this LH rises up, the reason why it's like that, LH, that's luteinizing hormone, sorry, rises up 24 hours to 35 hours before ovulation. For LH, it rises up before ovulation. You understand? For ovulation to occur, this hormone will rise up before ovulation. So you know your timing. You gauge yourself, and you time and you test at the appropriate time. Because if you don't know your cycle, you can just keep on testing and testing and having negative result, and you'll be thinking that you don't ovulate. And some persons, they tend to ovulate late, so their body might not follow the strict 14 days cycle, and that is actually normal. You understand? In some cases it's normal. So some of them might tend to ovulate maybe 16 days. For those of you that are 28 days cycle, that have 28 days cycle, some 15 days, and that is okay. You understand? So far as you ovulate. So another way to check is by using ultrasound. That is the best way to know if you're ovulating or not. If you're joining my live, you can just drop a comment, ask any question you want to ask. If you're joining my live, you're welcome.
Prophecy is not God's voice. You can be prophesying and you are not hearing God. Yesterday, some people asked me a question. They say, we're around you. We don't know God's voice direct. We can't know whether it's God that spoke or it's our mind that spoke. And I said to them, if you see me in church prophesying, that does not mean God speaks to me. Prophecy is not God talking to you. So that's why a witch can prophesy, a sorcerer can prophesy, anybody can prophesy. It doesn't mean God is talking to you. We saw in the Bible the